Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a very specific exercise that I like to give to patients who are struggling with utilizing their core muscles when doing overhead movements. So in a lot of cases, I'll teach clients proper ways to engage, right, their abdominal muscles and their pelvic floor for doing, let's say, a transitional movement of some type, or with lower body work, so sit to stand, having to go into maybe a squat or a lunge position. And in a lot of cases what I find is patients they'll get really good at engaging these muscles when they're weight bearing, or like I said, when they're having to engage more of the lower extremity, but they might not actually be aware of their lack of engaging these muscles when doing, let's say, an overhead movement, or when having to reach forward, or when having to maybe reach for something up on a counter of some type. And so they'll lack that engagement when doing that activity, and by doing that they're actually putting their lower back in a vulnerable position, right? They're not utilizing that core strength as well as they could in order to, again, protect the lower back and stabilize the pelvis, essentially. So what I'm going to show you here, you do this exercise lying on your back. So essentially you're going to be in this position here, knees bent, okay? And you're going to start with your arms at your side here. Now, the way that this works is you're actually going to start by doing a diaphragmatic breathing. So essentially what that means is I'm going to breathe in, and as I breathe in, my stomach is going to essentially protrude outwards. So I'm breathing in, stomach protrudes out, and then as I let go of that breath, I'm going to actually start thinking about hollowing my stomach, bringing my belly button in towards my spine as my hands elevate up. So the way that this exercise looks is breathing in, diaphragmatic breathing, starting to bring the belly button in, hollowing the stomach as I raise up my arms, and you just repeat this exercise. So you get into essentially a rhythm with this. So it looks like this. Diaphragmatic breathing, hollowing the stomach in. Diaphragmatic breathing out, hollowing the stomach in. Until eventually you get to the point where the stomach automatically hollows in as I lift up the arms. So you essentially, what you're trying to do is develop a very specific motor pattern by doing this exercise. And then ideally you'd want to translate this particular exercise to more of a functional activity. So then perhaps in a standing position, lifting up those arms as that belly button again hollows in as I engage my pelvic floor and as I engage the transverse abdominis muscle to, again, stabilize my core, stabilize the pelvis, protect the lower back. Thanks again for watching. Please make sure that this exercise is appropriate for you by speaking with a physiotherapist. And if you like this video, please comment and subscribe as well. Thanks again. Have a great day. Take care.